This table shows the 7 levels of communication down the left, with 5 major modes of communication across the top. The blue area shows the most typically used forms of communication. At level 1, the child's behavior is not yet intentional, but when the child vocalizes by crying, cooing, grunting, moves about, changes posture, or produces facial expressions, parents and other caregivers interpret those behaviors as communicative. At level 2, the child's behaviors are now intentional. Vocalizations, motor movements, and facial expressions become more varied and are under the child's control, although the child still doesn't produce them with the goal of communicating something to someone. At this stage, the child may be quite self-sufficient, filling her own needs by grabbing something she wants or pushing away something she doesn't want. We have the option of introducing electronic technology for the child with severe orthopedic or sensory impairment who's having difficulty connecting his own behavior with a reliable result in the environment. Various types of mechanical toys or switches that activate toys may be provided that the child can activate to cause a reliable and pleasurable effect. The goal is to instill the notion that if I do something, something reliable happens in the physical environment. We call that notion contingency awareness. It is not at this stage related to communication. At level 3, remember this is where intentional communication comes in, vocalizations become more and more specific, although they still don't take the form of words. The motor gestural behaviors also become much clearer and involve a lot of contact between the sender and receiver. The child may now make a face at mom on purpose to get her to make a funny face, or take mom's hand and try to tug her over to something she wants. Such gestures are extremely effective, but are ones that tend to drop out as we gain more sophisticated communication skills. We may see electronic devices in the form of calling systems introduced at this level for children with the most severe orthopedic impairment. Now the technology is being used to communicate. At level 4, vocalizations sound more and more like spoken words in terms of intonation. We also see very conventional gestures that we continue to use for the rest of our life to augment our language, such as nodding the head yes, pointing, and waving goodbye. At level 5, the vocal and gestural modes may specifically mimic properties of the referent, resulting in iconic sounds and gestures. For instance, the child might make a kissing sound to ask for a kiss, or pat a chair seat to ask you to sit down. At level 5, we have the first instances of symbolic communication in the form of concrete symbols, symbols that have a physical relationship to their reference. Individuals who are not ready to use abstract symbols yet may learn to use two-dimensional symbols, photos and line drawings, and three-dimensional symbols, objects that are used as symbols. In terms of electronic technology, we see some communication devices that incorporate the use of these concrete symbols, especially picture symbols, as a way to identify the messages. At level 6, we see single spoken words appearing in the typical child. In the augmentative modes, we may see manual signs appearing under the gestural mode. Abstract shapes or graphics may be used as symbols and possibly incorporated into an electronic device at this level. Finally, at level 7, we see combinations of 2 or more symbols constituting formal language. The symbols may be spoken words, manual signs, brailled or written words, or 2 or 3-dimensional symbols.